Thank you so much. I sincerely appreciate it. Thank you for inviting me. Thank you for thinking of me when you were thinking of someone to do your women's health talk. Thank you, Blessed Family, for welcoming me. And this is my second year, so looks like we're becoming family. I'm a board certified OBGYN, American Board of Obstetrics and Gynecology. But, ever since I was set free from, working under someone, I wanted to tailor my practice to gynecology only. So I stopped delivering babies and I focused only on women's health outside of pregnancy. And so I've gained a lot of experience just doing that day in, day out every day. Um, and so I wanted to, my goal in life is to advance women's health, basically let women know what they should know so they can make good decisions about their health. I'll be focusing on three categories today: preventive health, periods and fertility, and sexual health. Preventive health, because as mommy said when she was talking during the welcome address, a lot of people suffer because they don't know. Women come to me and I'm actually quite surprised at how much they don't know. So it's my job, my goal to educate women. I also have a YouTube channel that just shares information that women should know. So if you search me on YouTube, I should be able to come up with any topic women related. You can find it on my page. And then I'll focus on periods and fertility. A lot of women, when they hear that I'm an OBGYN, want to talk to me about their pregnancy, their fertility, things like that. And so I'll talk a little bit about that. And then I'll focus mostly on sexual health for the perimenopause part. When I start seeing women in their 40s, 50s, the conversation is different, where they're experiencing something different, completely from when they were younger, and their bodies are changing, and it's confusing, both for them and their husbands and their partners. And so it's important to touch on that as well. So I'll try to do what I can in 15 minutes. So 1:35. Okay. All right. So preventive health. Every woman 21 and up, whether or not she's sexually active, needs to have a pap smear done. Why do we care about a pap smear? A pap smear is looking at the cervix. What is the cervix? Let me see if I can find a picture. Right here is the uterus, and right down here is the cervix. Right down here is the vaginal area. So when a doctor is looking in the vagina, she's looking at the cervix and the vagina and taking a sample from the cervix here to make sure that there are no abnormal cells there. Why do we care? HPV, human papillomavirus, is a virus that's sexually transmitted that there's no way to test men for. So you know how people would do testing before they get married to make sure everybody is clear and there are no infections that they need to worry about? Well, there's no way to check men for HPV. It's only when we do pap smears for women that we find the HPV. And I get this question every single day in the office: how did I get it? And I'm like, it's sexually transmitted, maybe from your current partner, maybe from your previous partner. Either way, it's here. Why do we care about it? HPV on the pap can cause cervix cancer 10, 20 years down the line. If I catch HPV at 21, I can stop it from becoming cancer when someone is 41, because it takes that 10, 20 years to cause cancer. And so we have a lot of things we do to prevent that HPV from spreading, to prevent that HPV from growing. That's why we stress pap smear at age 21, whether or not you're sexually active. We know your baseline. If you then get married and get into a relationship and maybe your partner has been exposed to HPV before, he didn't know, he doesn't have symptoms, then we can be watching you a little bit more closely to make sure your pap smears do not become abnormal. Abnormal cells do not become cancer. So that's why we stress pap smear. So it's important. I'm sure even in the UK, there are free clinics where you can just go and get your regular annual checks done. I find that a lot of our people are too focused on surviving and they forget the things that will help them last long. So it's important, even if you don't have insurance, you're not documented, I'm sure there is a free clinic somewhere that can get you a pap smear. I always recommend STD testing, even just once a year. People who are married sometimes will sound offended when I say, "Oh, do you want me to do any testing today?" But I always tell them, you just have your normal screen once a year. And then mammogram. Okay, so mammogram, I'm sure everybody over 40 knows that they need to get a mammogram done. If there's breast cancer in the family, though, we need to do it sooner than 40. So mammogram is for women 40 and up. But if somebody, let's say their mom, their dad, some men have breast cancer, so let's not ignore that. If there is a male breast cancer in the family, it's highly likely that it's hereditary and more likely to happen in other members of that family. So that needs to be genetic testing and all those things need to be done. So the mammogram is to help us find breast cancer early, just like the pap smear is to help us find abnormal cells before they turn to cancer. Mammogram is for us to find breast cancer early. I had a patient who had a mammogram. It looked a little bit funny. They did a subsequent mammogram and then they did a biopsy and it was stage 0. Stage 0 is where we want. Stage 0 is the reason we do mammograms so that we can get it out before it has a chance to grow. By the time somebody's feeling a lump, that's stage 2. We don't really want that. We don't want you to feel a lump. We want you to be getting your mammogram so that if anything is looking microscopically funny, we can take it out before it becomes something visible, physically present. Colonoscopy is 45 and up. So the recommendations have changed. Before it used to be 50, but now they were finding especially African American people with advanced stage colon cancer showing up at 49. So we are no longer waiting till 50 to start colonoscopy screening. We're starting at age 45. However, if there's a family member with colon cancer, we're doing the colonoscopy earlier at 30, at 35, so that we can catch it sooner. The goal of preventive health is to catch things early to prevent them from becoming incurable. Bone scan is for women 65 and up. So let me do a recap. Mammogram, 40 and up. Colonoscopy, 45 and up. Bone scan for women 65 and up. Mostly because at 65, you don't have a lot of hormones anymore. There's not a lot of bone support. And so we want to make sure you don't have fragile bones called osteoporosis. So those are the things I talk to women about at their wellness exam in women's health. Let's move on to periods and fertility. I want to show you this diagram here. This is a picture of a uterus, like I said, tube and ovary. Tube is here, ovary is here. Tube is here, ovary is here. There are millions and millions of eggs in our ovaries. Once we we're born with all our eggs. Women, I'm talking about women now. We're born with all our eggs. Once we hit puberty, we start ovulating, meaning we start releasing one egg each month. At least that's the normal way it's supposed to go. And so you'll see that the eggs are small until one egg grows. Once it's fully mature, it releases the egg into the fallopian tube. That fully grown egg is going to make a lot of estrogen that fills the uterus with blood. So you can see this egg is growing, becomes mature, it grows big, releases the egg. Now, if someone is sexually active, sperm inside the vagina will travel up through the vagina, through the uterus, through the tube to meet the egg. Fertilization happens, the embryo will travel back through the tube into the uterus where there's a rich blood supply to become a pregnancy. If there is no sperm around, the person is not sexually active, she's not married. The egg would just stick around for 36 hours. After 36 hours, if nothing happens, the egg disappears. And the blood that we have filled the uterus with, that the mature egg has filled the uterus with, comes down as your period. So each month, you either have a period or you're pregnant. If you're not having a period, you should be pregnant. If you're not pregnant, you should be having a period. And so if somebody is not having a period and they're not pregnant, something is wrong with this process. Is it the release of the egg? Is it the making of estrogen? Is it the filling of the uterus with blood? Lots of things. What's going on in that place? So common causes of abnormal periods is what we call anovulation, meaning no ovulation. Meaning this lady did not make a mature egg. And so there's not a lot of estrogen made and there's not a lot of blood filling the uterus with blood and filling the uterus. And so she doesn't have a period that month. The signal for things to start is the maturing of the egg and the release of the egg called ovulation. PCOS is also another cause of that. PCOS is called polycystic ovary syndrome, meaning she makes the mature egg, but it doesn't get to the full size that needs to release. So she'll have a whole bunch of eggs that are kind of like arrested. And so the ovary becomes big and it has many cysts. Those women have a lot of issues with heavy bleeding. They won't bleed for 3 weeks, for 3 months, and then they'll suddenly have a period that'll last 2 weeks. And so those are very complex things that we treat when women show up with abnormal periods. And Those are the things that affect fertility. So if someone is trying to get pregnant, first thing we look at is, are you having a period every month? If you're having a period every month, tells me you're releasing the egg. The other big thing is the tubes are normal. The tubes are open. If the egg releases, the ovary releases the egg in the tube, and then the sperm is trying to come from the vagina to the uterus, but there is a blocked tube, the egg after 36 hours will go away. So the sperm cannot get to the egg if there's a blocked tube. So that's another cause of infertility. What causes blocked tubes? STDs. That's why I always tell my patients, even if you feel like you should not have an infection, just check. Because most women don't have symptoms, but there is a sexually transmitted infection that is infecting the uterus and tubes and causing damage. So those are things we look at when people are talking about fertility. And then premature ovarian failure is when someone goes into menopause early. So even in their 30s, they're supposed to be having maybe 20 million eggs and they only have 100,000. Such a woman will not be able to ovulate regularly in order to have periods. So that's periods and fertility. Other things that cause abnormal periods are fibroids. Fibroids are tumors. I'm sure we've all heard of fibroids before. They're tumors in the body of the uterus. They can be on a stalk like this one. Someone with this type of fibroid will have a lot of pain. They just be like, because this thing is pushing on the things that are in the pelvis. Things are not supposed to be pushing out of the uterus. Someone with this type of fibroid is going to have very heavy periods because remember, this is where the bleeding comes from. And you have a tumor pushing into the cavity of the uterus, the bleeding is going to be very heavy. And so those are also causes. I actually had a patient, her fibroid was right here. So it was blocking the opening into the tube. And so she came to me for infertility. And when I did an ultrasound, she had a fibroid right here at the opening into the fallopian tube. So even if the sperm is coming from the vagina trying to fertilize the egg, it cannot get past. So those are common causes of infertility. Let's jump to sexual health. Why do women lose interest in sex? Women lose interest in sex because of lack of hormones. As they get older, remember, as they get older, the eggs in the ovaries decline. If the eggs reduce, estrogen reduces. If estrogen reduces, women don't have their hormones and they lose interest in sex. And so it's important for husbands to be very aware of that phase of life, starts around that 39, especially women who have a lot of children. Even if you have 2, 3 children in this advanced society where you don't have a lot of community support and you're doing a 9 to 5 job or you're working nights, then you have to take care of the children. You have to help them with their homework. How you have to take care of the house. You're going to be easily drained and there's no capacity at the end of that day to be present for your husband or your partner. And so it's important for men to be aware, men to step in, men to recognize that, okay, this woman is overwhelmed. How can I help her? Because for women, sex starts in the mind. It's not I see you and I suddenly feel the hormones. For women, it's mind. She has to feel supported, feel like she's in a safe relationship. She has that security. That's what's going to drive the hormones in her body. So even if she's overwhelmed and doing a lot of things, if she has somebody supporting her, going along with her, it endears her to the person and brings up the hormones. But sometimes some women, even with all the endearment and safe relationships, if they're around that age where their eggs are gone, or maybe she went from 20 million eggs to 100 eggs, the estrogen amount is like maybe it used to be 400, estrogen is now 20. Such a woman is not going to be able to generate enough sexual desire for sex. So it's important for women themselves to understand that and for men as well to be patient during that period of time. So that's what I said here. What's needed for a woman's sex drive? Mind and body. She needs to feel healthy. She needs to feel beautiful. She needs to feel supported in her relationship and not overwhelmed. And hormones. We talked about that already. Um, some women lose interest in sex after having babies because again, they're breastfeeding. When they're breastfeeding, hormones are low. And so those are things to compare. Stress of life, like I said, midlife issues, that's when you start, getting that 45 and up. And then menopause issues, those are things that can affect a woman's sexual desire. And then when menopause happens, imagine a woman who's sweating profusely, hot all the time. I had a patient, she has to leave a board meeting to go and change her shirt in the bathroom because she was drenched in sweat. She had a hot flash. It's like heat from her chest upwards into her face. She's sweating, stained her shirt. Had to leave the meeting to go change it. So, I mean, so embarrassing, so disruptive. Also, doesn't let them sleep. They are throwing the covers off, throwing the covers on. Once it's too hot, they throw the covers off. Then it's too cold, they put the covers on. So they can't get enough rest. If they're not getting enough rest, they're irritable, they are tired, they're just their mood is up and down. Their family start complaining that what's wrong with you? You have changed. Why are you angry? Why are you impatient? Well, one question I ask my patients is, do your family members say you've become impatient, or are you finding that you're impatient with your loved ones? Things that they will do that didn't get to you before suddenly begins to annoy you. That's one of the signs that your hormones are low. Concentration problems. I had a lady who was a banker, and she works with numbers all day, and she was losing focus. She thought maybe she had to retire, that okay, maybe her body's telling her that she can't do this job anymore. She was basically just missing hormones. And then low sex drive. Imagine a woman not having sexual desire is not going to lubricate, and so sex is going to become painful. I had a lady come to me just last week, told me that sex is painful, number one. She doesn't have the desire, number one. She's trying to be understanding of her husband and just to do her wifely duties. But because it's painful, she doesn't have the desire. She always looks for a reason not to avoid that. And so it's important for husbands to understand, okay, something is changing with your body. And also the woman to understand something is changing with your body. This lady was considering leaving her marriage because maybe her husband needs a woman that can satisfy him. And I was like, no, let's not jump there yet. Let's see if there are actual medical issues we can fix before you leave your marriage because you're having this. It's a big deal in a relationship, not to be able to um provide that desire to your partner. And so it can really lead to low self-esteem for the woman, lead to such lack of confidence in herself. She even thought, maybe I'm not attracted to this man anymore. Maybe that's the problem, and I should just leave him to find somebody who's attracted to him. But I was like, let's check blood work and see what your estrogen is, your testosterone, all those things that affect your well-being. And so around that 45 to 55, when the eggs are going away, women start to just feel disorganized. They can't focus, they can't sleep, they can't concentrate. Job performance is going down, home performance is going down. They feel like they're not themselves. Time to talk to your doctor about menopause. Um, Men also go through menopause. Men also start to experience low energy level, joint pains, erectile dysfunction. That's the time to go talk to your doctor. For men, if they're on high blood pressure medicine, it can affect their ability for performance. And so heart medicines, blood pressure medicines, diabetes medicines, important to be healthy. So lifestyle, it's important to sleep well, lose weight. A lot of us, we need to lo lower the amount of carbohydrate we eat as we get older. We don't have that energy to burn it off unless you're working out every day. You're gonna store it, it's gonna weigh you down, it's gonna affect your ability to be your best self. Counseling, I always recommend counseling. Some people will come to me for hormones. I'll give them hormones, but if the home situation is not good, doesn't matter how many hormones I give you. The home
Mm-hmm.
relationship needs to be good.
Mm.
Do you
Mm.
want me to, is that my cue, Ma, to stop?
No, 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 no.
Oh, okay.
Just I'm enjoying you.
Thank you. Thank
No,
you, doctor.
no.
Thank you, doctor.
Okay.
Just before she continues, we have about 1 minute for you to wrap up so we can take maybe one or two questions.
Okay. Okay.
Thank you
Uh,
very much.
no problem. So after the counseling, the lady that I was talking about just last week, oh no, just this week, who was thinking of leaving her marriage, I said, do you have a good relationship with your husband? Are you guys friends? Do you feel safe in your relationship? That way, I'm not fighting against something beyond hormones. And she said, outside of the bedroom, we're great. We have a great relationship. We can talk for hours. Once it comes to the bedroom, she's looking for ways to avoid. She's staying in the bathroom a long time, waiting for him to fall asleep. So I was like, okay, then maybe it's just a hormone problem. If we fix the hormones, get you feeling beautiful, feeling healthy, concentrating, self-confidence is back, maybe we can fix that relationship. So now hormones, people are scared of hormones and stuff. Yeah, in those studies where they did the hormones, the hormones that cause the problem with tablets. And so we have found ways around that. We give patches now, we give injections. That way we can avoid the hormones that are increasing the risk of breast cancer, heart attack, and stroke. So I tell my patients, hormones are everything has risks, right? We have to find the right one for you. Can you take a cream instead of a tablet? I actually don't even use tablets for that reason. I use creams, patches, injections, things like that. But it's a hormone problem. It needs a hormone solution. So if sex drive is an issue, there's nothing I can give you on this earth aside from hormones that's going to bring your sex drive back. There are some people who maybe can get it naturally from exercise, but that means you have to exercise every single day. Most working women don't have that luxury. If you're going to do hormones, I recommend bioidentical hormones, not the ones that are synthetically manufactured. And so it replaces what is lost, reclaims your energy, helps you to feel like yourself again. Some women also start feeling that vaginal dryness. That vaginal dryness can cause recurrent urinary tract infections. Every time you're going to the doctor because you have a bladder infection, that might be vaginal dryness. We put estrogen back in the vagina, helps you to lubricate, helps the bladder to lubricate. You stop having those vaginal infections. You stop having pain with sex. Any woman having pain with sex who is in menopause needs estrogen in the vagina so that sex is not painful. It is very, very important. If sex is painful, the woman is not going to be interested in being sexually active.
We have a question here, doctor, that says, how can we detect HPV in men?
Like I said at the beginning, we don't have a way, men don't have a cervix. We cannot do a pap smear on men. The only time we find HPV, the HPV that causes cervix cancer, is when we do a pap smear on the cervix. Now, there's some HPV that can cause genital warts. Those ones you can see the warts on the genitals, and so you avoid intercourse with such a person. And so really, until we do a pap smear on a woman before we know that she's been exposed to HPV, and then she can now start looking and saying, okay, this is the only person I've ever been with. He probably was exposed in an earlier relationship, things like that. The goal is not even at this point to start finding who gave it to you or not. The goal is to make sure it does not cause cancer, and that's why you get a pap every year.
Okay, thank you so much, doctor. I think the question was directed at men, such that considering you have said women, it's sexually transmitted. So how do men sort of treat themselves or detect so they don't transmit it to their spouse?
Good immune system. So making sure because it's a virus that the immune system has to fight off. So it's possible to clear it from your body. Good immune system, multivitamins, and not smoking. I'm sure we're all Christians. Yeah, nobody here smokes. Nicotine makes HPV stick around, harder to clear. So as long as your immune system is good, there's no way to really know if you have it until your partner comes back with a positive pap smear. So,
Okay, thank you.
Yeah.
Let's take just one or two more questions. We're really running out of time. Please, is it normal? Someone is asking Oluwatoyin Oluwadamilare. Is it normal to start experiencing menopausal symptoms at 30 years of age?
No, it is not. Absolutely not. Average age for menopause is 45. Now, some women are experiencing menopause-like symptoms, but they're still having a period every month. So let's be sure that the menopause we're talking about is not cessation of menses. When you go 12 months without a period, you're in menopause. So if you're still having periods, but you're having hot flashes, you're having night sweats, it could be perimenopause or low testosterone. I have patients who are 39, they have a monthly period, but they're having hot flashes, they're sweating, low sex drive, their testosterone is probably low. Those women, I replace testosterone, they go back to normal.
Thank you very much. I can see Pastor Mrs. Taiwo Coyote has a hand raised. You have the
Yes.
platform, ma.
You know, there are so many questions in the chat. Doctor, please, you will still come back to us. This is our monthly live stream, please, because we can't answer all the questions today. I can see so many questions.
There's one I do want to answer, though. Is there such a thing as vaginal tightening after birth? Absolutely. Actually, I skipped that video. I skipped that PowerPoint in my, am I still sharing my screen? Let me see.
Yes,
I skipped that PowerPoint because I actually do this procedure in my office. It's called vaginal laser rejuvenation. It leads to vaginal repair, it strengthens the vagina, helps with lubrication, and so makes sex more enjoyable. Now, this is for women who don't want that vaginal estrogen I was talking about. I said if the woman is having pain with sex and she's in that menopause range, she needs vaginal estrogen. Some people, maybe there's a lot of breast cancer in their family, they don't want to risk hormones. vaginal laser is the way to go. It does tighten the vagina. It does help with lubrication, increase sexual sensation. And if you do it, you should do it with a doctor. There are a lot of med spas that do it, but just do it with a physician to be on the safe side. I wanted to make sure I addressed that.
Well, I'm so particular about this preventive health. And you spoke about bone scan. You know, it's actually new to me, let me tell you. So when can we have bone scan? And why? I think let me ask why, not when. When do you think?
So 65 and up. Any woman who's 65 and up needs to have a bone scan. Reason we need a bone scan is because of menopause. When you're in menopause, you lose estrogen, you lose bone support. So women have fragile bones. They are easily fractured. It can actually, I don't know if you've heard of women having hip fractures.
Yeah.
Hip fractures and they can't walk again, then they become immobile. It's like one of the fastest ways that leads to women's deterioration and death, even at that 65, 67 age. So the reason we don't see it as much in the African American community, but actually that's a myth because people are like, oh, we are strong-bodied, strong bones, we're Africans. That's why, actually I found a lot of African American women. My patient population is all mostly African American who have osteoporosis and they need to be getting bone scans so that we can.
Okay, thank you. There is one other question. This pap smear, how often and when?
Pap smear,
because it's necessary.
Yes. So if you've been getting your pap smears regularly, it's been normal, you can do every 3 years. You still need an annual every year. A lot of people say, oh, they told me pap smear now every 5 years, so I don't come to the gynecologist until every 5 years. No, you still need somebody to look inside. You still need somebody to do a breast exam. You still need somebody to do a vaginal exam. You need an annual every year, but you don't need a pap smear each annual. A pap smear is a test, just like a breast exam or an STD test when you go to the doctor. It's one of the tests we do at your annual. And so it's important to go to the doctor so they can determine, okay, is it time for another pap or is your pap smear from last year still appropriate?
Okay, thank you. Somebody is asking for addressing you. I think we'll put details of Dr. Durowade in the chat, please.
Okay.
The YouTube, the website. You have a practice, I believe.
I do. I have a private practice in the US.
Yes. So, because someone is asking in the chat, but because of our time, Doctor, we can't get enough of your wisdom. I always say knowledge is supposed to be common, but they're not common.
Somebody asked a question here. I feel like I addressed it already in the earlier talk. It says, what could make a 38-year-old woman, mother of two, suddenly lose interest in sex? You remember that PowerPoint I showed you about stress of life, 9 to 5, being overwhelmed and low hormones. And so if there's a replay of the video, you can go back and watch it. I addressed that already in the talk.
Thank you so much, Doctor. We are really grateful. We can't get enough of you. We believe that we'll have in one of our monthly live stream again.
Thank you, Mom.
We are grateful.
Thank you so much.